Morning, everyone. Welcome to our second webinar of the Office for Prevention of Family and Domestic Violence. My name is Nicole Leggett and I'm the Executive Director of the Office. Joining to me is Stacey Collins. She works in the office with me. She's the Director of Service Design and Innovation. Thank you for joining us today, and my apologies that we postponed last week's webinar. Unfortunately, Teams wasn't working for us last week, so we had to postpone the week to today. I hope you got an opportunity to have a look at the slides, though if you didn't, I'm presenting today the same slides that we circulated around to you last week for your information. I'd like to start by acknowledging that we're joining you today from Walyallup on Whadjuk Noongar Budja and pay my respects to elders past, present and emerging, and acknowledge the traditional owners of the lands that all of you are joining from today, noting that we probably have people joining from all over the state. The format for today's webinar will be similar to last week. I'm intending to run through 3 basic agenda items. I would encourage you to post questions in the chat the whole way along. And if you see a question that you like, please like it, and then that will give us the opportunity to prioritise the questions during the Q&A at the end that we answer first. Any questions that we don't get to today, we will either we'll provide a written response to and circulate around to everybody. But at the last webinar, we did get through all the questions, so we'll keep going, until they're done within the time allowed. And I guess really what we're wanting to achieve through these webinars is just to give you ongoing updates about the work of the office, and particularly the commissioning work that we really spoke about last week and are doing a big body of work on. So today what I'm going to talk to you about is the Office for Prevention of Family and Domestic Violence, its establishment and what its key functions will be. I'll give you an update on the commissioning, and I'll also talk to you about a few sort of like milestones that have happened over the last week or so. So I guess moving on then, our first agenda item is about the Office for Prevention of Family and Domestic Violence. So many of you will know that we undertook a consultation process last year to get people's views and ideas and thoughts about what a strategic policy office around family and domestic violence should do, and the best value add that it can have to the family and domestic violence service sector. So I was a part of the early stages of that consultation process, and then Elise O'Sullivan, working with Stacey and Selena Gatley, who's our other manager in the office, carried that work through into the later part of last year. And really, that consultation process, which included a discussion paper, which included some face-to-face consultation with all of you, included some lots of meetings and discussions both with our external stakeholders and in this agency, really led us to a bit of a clear picture around what we think the key functions for this office are, what the structure is and what the priority projects are. And that's really what I'm going to take you through today. If I can go to the next slide. So what we really heard is that people really want to see clear leadership, and I suppose stewardship might be a better word, in the area of family and domestic violence. So being really clear and on the front foot around what the emerging issues are, how we might be able to provide direction and support around emerging issues and themes and trends, providing leadership in all of the various stakeholder environments, including in work with the Commonwealth around the National Plan to Reduce Violence Against Women and their Children, leadership on our state planning strategies, including Path to Safety and soon the Aboriginal Family Safety Strategy, and also on, I suppose, just various different policy matters that come up from time to time. For example, coercive control, which is a topic of great interest at the moment, and also the work that is coming and is happening on the sexual violence prevention and response strategy. So, really, I guess what we heard from people is to have a very clear, visible and vocal leader in the area of family violence, really clearly working alongside the 2 peaks in stopping family violence and the Centre for Women's Safety and Wellbeing. They really wanted to see an office that most fundamentally worked alongside the stakeholders and particularly the sector in a way that engaged people on issues and really, I guess, started from a place of collaboration. They really wanted to see work that was clearly aligned to evidence and working towards our outcomes. And I think, we had a lot of discussions about outcomes in all sorts of different settings, right from how we think about and design our progress reports, and the information and data that's captured in them and how we can use them more constructively, through to how we lift that systems level data out of the systems, or how we influence the data that's captured in systems so that we can be in the best position possible actually to really understand what's going on and to be planning and providing responses that are informed by that evidence and information about what's happening in services and for people escaping family violence. The other key things that we really heard was about having really clear, a really clear vision for what we're trying to achieve, and we've represented that here in terms of blueprint for reform. And one of the things that we'll talk about later in the webinar is the commissioning work, and I see the commissioning work as being so central to giving us that really clear blueprint for how we're intending to achieve our strategic outcomes insofar as how we buy services into the service system. So the services that we commission through the Department of Communities to operate in our community. The other two things that people really thought were important was that we've got a clear role in advocacy and advocating around issues, and we see that as being a role that we take on both within our agency and how we advocate for family violence to be a primary issue for consideration in all contexts of service delivery of this agency, as well as how we advocate for our services and better outcomes for victim survivors and better responses to perpetrators in all the various forums and settings that we're in, and also a role in raising awareness and education. And I think people really felt that those fundamental functions absolutely have to be led and underpinned by a cultural lens, both in terms of being culturally responsive for Aboriginal people and culturally and linguistically diverse people, but also that we're really holding all the time that although our focus is family violence, that in many cases that's inextricably linked to gender inequality and to people's experience of sexual violence, and understanding how all those things thread together. So really, I guess, taking what we've heard from people, this next slide will give you a bit of a sense of how we see the basic functions and operations of the office. So really thinking through those functions as underlying and underpinning everything that we do. The way that we have intended to establish the office is to include a focus on three key areas, and they're the blue circles that are really running through the middle of this slide. So the way that we are setting up the office at the moment is to organise our work into three discrete teams. Our first team, which is Strategic Policy Design and Delivery, is led by Selena Getley, and that's our work around our strategic policy. So that's where we're really doing our work around implementation of Path to Safety. It's the team that will do that work around thinking about what have we achieved as an outcome of the first action plan, and then how do we produce a second action plan that's going to kind of move the dial that bit further towards safer outcomes for victim survivors. So they'll be doing that work around Path to Safety implementation. They're currently holding that work around the Aboriginal Family Safety Strategy and also around the Sexual Violence Prevention and Response Strategy. The next key area of work for us, which Stacey leads, is system reform and innovation. And that's really where we're delivering our election commitments and also where we're holding our commissioning work. And then very importantly, particularly for me, the third area of work is about our family violence practice within this agency. Some of the priority areas for 22 across all of these three areas would be pieces of work that you've probably heard us talk about at different times, and certainly in just what I've been reflecting on so far, but it's absolutely about finalising the Aboriginal Family Safety Strategy, absolutely about delivering the election commitments that were committed by the WA government leading into the 2021 election, is absolutely the piece of commissioning work which we'll come to later, and really keeping Path to Safety atop the agenda and being really clear about how we are taking that work forward and implementing the key principles of that work, the actions identified in that work, and, you know, keeping attention to what we represented as the focus areas of that work. So this slide really, I guess, speaks to, really, I just builds on what I've just been talking about, which is what are the key pieces of work that we're undertaking in each of these teams at the moment. And I should note that at the moment, these teams aren't full. So we're currently at about 45% staffing, but over the next month, we'll bring that up to about, I'd say about 70, 80%. And then, you know, and a little bit on from that, we should be at a near full complement of staff, which will be about 16 FTE. So I'm not going to run through all of those things because they are long lists and you can see them in the slides. But I guess if I can just, the other point that I really wanted to make is what we're also trying to achieve with the office is to get to a point where we are a single point of contact or the central point of contact for all family violence matters for the agency. So at the moment, there are bodies of work and really, in some cases, very high profile pieces of work that are led by teams that are not in the office, but we're working very closely with them and working hard on making sure that the office is a place that people can come to for any matter, and that we'll do that coordination and work behind the scenes to make sure that you get the answer and the response that you're looking for. So some of the key pieces of work that are currently led by teams outside of the office is the establishment of the hubs. So the work to procure the Armidale hub and the work that will be upcoming soon around designing the Broome hub. The work around procuring the youth counselling service in Northam and Rockingham is also being led through a different part of the department, but we are absolutely involved in that and making sure that that's part of the thinking around all of the various aspects of work, like path to safety implementation, like our commissioning. And we're also working very closely around the family and domestic violence response teams. This next slide goes to a little bit of the work that you probably had a bit less visibility of from us in the past. You're probably familiar with the work of the office and previously the work of the Family and Domestic Violence Unit, really in being in that strategic planning and in the delivery of programs and election commitments. That's functions that have been very well established in this team for a very long time. One of the key interests of mine and a very important area of work that this team will be starting work on very soon, we're doing sort of some early planning at the moment, is really about how this agency responds to family violence and how we can think about promoting a consistent and quality response wherever people interface with in this agency. And I guess just for interest, you would all be aware that family and domestic violence is the most investigated and substantiated form of child abuse. It is the leading reason that we bring children into care. It's the leading cause of homelessness for women and children, so it absolutely impacts on all of our housing responsibilities and functions. It's a significant factor that's impacting on the stability of people's tenancies and the various issues that can arise in relation to their tenancies with us. It is absolutely one of the fundamental reasons why reducing the gap in health and wellbeing outcomes for Aboriginal women is so difficult. And it's an issue for us as an employer of many, many women and also just many people in our community. We have a staff of 6,000 people, and like all of you, we need to be cognizant all the time that our staff may have or may be experiencing violence, may be perpetrating violence, or may still be living with the aftermath of violence, whether that be experienced as children or in their adult lives. In terms of what our opportunities are to work differently and better, we're looking to influence across the breadth of functions that we have in this agency. So in and among all of our staff, in the way that we invest in all of our services. So we've included a budget line item there that we're currently investing about $76 million specifically in family and domestic violence. But we also invest significantly in all manner of other programs like homelessness, like out-of-home care services, like earlier intervention and family support services, like child sexual abuse therapeutic services. So we're really looking at how we can both influence what we commission for family and domestic violence specifically, but how can we build capability to deal with and respond to family violence in all of those other programs that we're funding. We're also thinking about and looking at how we set a framework for response in this agency, or how we support our staff to be family violence informed across all of our child protection service delivery, all of our frontline housing, thinking about our after hours crisis services and responses, and of course, importantly, our family and domestic violence response teams. So this is a piece of work that you'll start to see coming through from us a little bit more, and I think is a real opportunity to start thinking about and doing some of the dovetailing work between what this agency does and the services that we are funding and working within the community, as well as with all of our partner agencies that are sitting alongside with us. So I guess that really covers everything I really wanted to say about establishment of the office. Stacey is here with me today. Selena unfortunately couldn't join me, but we'll be happy to take and answer any questions that you've got about what we're intending to do in the office, but also if you've got questions about specific pieces of work, we'll be happy to answer them as well. The next thing that I really wanted to talk about this morning is to give you an update on commissioning. I gave a commitment at the last and the first webinar that we would speak to commissioning at every monthly webinar, so that you've got really good visibility, we hope, of the work that we're undertaking in this space. So if I can get you to move along. What I spoke to you about at the last webinar is that the commissioning work in the area of family and domestic violence will deal specifically with two things. But as I mentioned earlier, I see that this commissioning work is absolutely fundamental to our implementation of path to safety, and absolutely fundamental to our implementation of the Aboriginal Family Safety Strategy. It's the opportunity to think about what we want our service responses to be, to do that thinking about, what might we do with our existing service group, as well as how and where would we prioritise future investments. So there's lots of things that we'll be thinking about in that space, and lots of consultation, engagement and discussions that we'll have with you along the way. But I guess I'm just trying to reflect that I feel that this is a very important and significant opportunity for us to start thinking strategically about where we want to take our service response into the future. So as I spoke about last week, there are two pieces to this work. The first piece is a business case to government about addressing viability issues for our family and domestic violence refuges and safe houses. And this is about an uplift to funding to maintain existing and deliver on existing contracts. So it is not an ideal state piece. It is not about future state service delivery. It is most fundamentally about how we support sustainability and viability in the services and contracts that we have for our family and domestic violence refuges and our safe houses. The next piece, which is probably the more strategic piece and the piece of work that is a bit more future focused, is about how we really put that blueprint together for where we want to get to. So what is the change or reform that we would want to see in our existing family and domestic violence services? And then what we think are the priorities for future investment towards that ideal state. So being really clear about what we're trying to achieve, what our desired outcomes are, as well as how we get there in terms of mix and different kind of service models and array and composition of the whole service system. A key piece of this more strategic work is also about how we hold and manage the assets in this space, which is the buildings, particularly our accommodation buildings that people are working with and operating from, because we absolutely understand that the type of building, the design of the building, the capacity of the building, these are all things that really set the parameters around what the service can do. So the asset itself is fundamental to the design of the service model and really the design of what we can offer to people within that model. So a strategic asset plan will be part of our overarching commissioning plan, and we'll be thinking that through from the point of view of what are the condition of our current assets, what is the capacity of our current assets, and what are the opportunities to grow that capacity, but ultimately how do we move to a place where we've got fit for purpose and built for purpose design. So really about how do we set kind of that strategic agenda towards rebuild. In the context of the commissioning plan, so that more strategic piece of work, we had a few questions at the last webinar, and it's been a discussion in communities and with our expert reference group so far, is what is the scope of this piece of work? And I guess what we've been talking about is that most fundamentally, this commissioning work is about how we influence the services that communities funds. So broadly, that's $76 million that's going into the community at the moment. How do we think about what we want that money to do? What are the outcomes that we're working for? How do we support a evidence-informed, sustainable service system response that addresses the needs of victim survivors, adults and children, as well as providing a response to perpetrators? Acknowledging that that's not the whole service system, that there are many, many services that are funded by other government agencies, including the Commonwealth, that there are frontline services provided by government agencies, and that actually the outcomes delivered by the communities funded services have a high level of dependency on what else is happening in the service system. So by my thinking at this point, and I'm happy to have questions about it, and I think it's certainly going to be something that we talk about in an ongoing way, is that the commissioning plan is fundamentally about community services that we fund, but in doing that, we will have to make comment about how those services can be supported to have the best impact and effect in their community, which is about how the rest of that service system operates. So although the focus is most fundamentally about what we're funding, it will represent and speak to what those other key elements are in services funded by other government agencies into the community, as well as services delivered within and by government. The next point that I really wanted to make is to give you an update on timeframes. So as I spoke about at the last webinar, we have convened an expert reference group, which is comprised of representatives from family and domestic violence services, both community sector organisations and Aboriginal community controlled organisations. So far, they have met on 2 occasions, on the 27th of June and the 18th of July. And the focus of those 2 meetings so far has really been a lot of discussion about scope, and particularly the scope and parameters for the business case as a start. So that piece of work, which is about making a case to government about about the viability and sustainability of our refuges and safe houses. We have 2 further meetings booked, one on the 8th of August, one on the 29th of August. Oh, sorry, week of 29th of August. And those meetings will start to get more into the detail. So what's the data we've got to hand? What's the information that we need to be talking about to inform our financial analysis? And then that will lead us into sector engagement more broadly in early September. So really, I guess what we're trying to achieve is that we come to the sector engagement with some information and products to start the discussion. So we don't want to come in cold. We know we've had lots of discussion about many matters related to this over the years, including in the design labs that were held last year. So we really want to make sure that we're consolidating the information that we have, so that when we come to the sector engagement and consultation, that we're starting from an informed place of what you've already told us and the data that you've already reported to us through your progress reports and the like. So this gives you a little bit of an idea around our current and early thinking about what will be in that business case. So what is it that we're going to be considering and representing? and we very much see it as comprising two key parts. Most fundamentally will be the financial analysis around cost, but the second part is really representing what it is that these services do, representing the complexity of the work, the complexity of client presentation, the range of activities that we do, the range of supports that we provide for victim survivors, and that will really form up, I guess, the policy argument and the justification for why the investment is needed. I think I just reading what I've got on the slides there. So it's very much about representing current state. So where we have services, what their funding levels are, the locations, what the history of the contracts has been, and how we've gotten to this point where we have a fair amount of variance in contract value. So we'll explain some of that history. We will talk about client information in terms of profiles and complexity of need, and then we'll talk about what the implication of all of that is for services, as well as what the baseline is around what their contracts say they need to do, and then how that impacts on the allocation of cost. So the business case itself will hold two spaces. It will speak to what the cost of delivery is, as well as what the context of delivery is. So the third thing that I was going to talk to you about today before we move into our Q&A, and I encourage you again to post questions in the chat, like questions that you particularly want answered, and feel free to ask questions across everything that we've talked about. But it's just to give you a little bit of an update on some things that have been happening and are happening in the near future. So if I can get you to move slide, thank you. So last Thursday, we released the tender request for the Armidale Hub. So that is currently available on Tenders WA, and that really represents the culmination of a significant body of work with the Armidale community around design of that service, as well as all the work that goes along in parallel to that to get to a point of procurement. So that tender request is there and available. And I believe the tender briefing, which it's remiss of me of not having here, is Thursday of next week. But when we send these slides around again, I'll confirm that date and time with you. We're also getting close to releasing the tender for rapid rehousing. The early tender advice has already been out, but we're getting to a point where we expect to see that tender published on Tenders WA very soon. And when that happens, we will also send that around to give everybody visibility of it. We are leading into our design process on the Broome Hub. So we're hosting a webinar on the 9th of August for predominantly for our stakeholders in the Kimberley community. And really it's a webinar that's about providing the foundation and context for the engagement and design process. So it'll speak to what the intention of the hubs is, what they're intended to do and why they're, proposed to happen in the way that they have. What does the Goldfields and Mirrabooka hubs look like, and what have been the early learnings from those processes? We will hopefully have someone joining us from Curtin University who can speak to that early research that they did that sort of formed the foundation for all of our work in this space. And we will have the innovation unit, who are the consultants who have been engaged to undertake the place-based design, joining us to talk about their process. So really this webinar will be about setting the scene and giving particularly our Kimberley stakeholders with a good base of knowledge about the hubs and the design and then the procurement process, so that they, are starting from an informed base really. Women's Safety Ministers meeting occurred Friday just gone on the 22nd of July, and that was the first time that ministers from all states and territories responsible for the women's and family violence portfolios met since the change in federal government. So I believe that there will be a communique coming out as a result of that meeting, and we will circulate that around to all of you with our notes from the webinar. I also wanted to note that the next webinar of the office will be in 3 weeks, which will bring us back in step with our sequence that we would have had there not been a global outage on Teams last week. And really what we want to focus on in the next webinar is, as well as giving you an update on the commissioning, because we will do that at every one, but we really want to start talking to you about a piece of work that we are undertaking around refreshing the common risk assessment and risk management framework. So I guess we will give you an overview about that piece of work, but we might even see if we can build in some polling or survey questions so we can start to get some real-time feedback about information that will really help us set the scope for that piece of work and what it is, or how people are using common risk assessment now and what it is that they would like to see in the next iteration. So that's everything that I was planning to present this morning. I would encourage you to put your questions in the chat, and I'm going to turn to my colleague Sandy, who's going to read some questions out, and I'll do my best to answer them. If I can't answer everything, we'll come back to you. If we don't get to all the questions today, then we'll provide a written response to the ones that we don't get to.
Having said that, we've had just the 3 comments posted, so hopefully while we're talking there may be more come through that we'll address. We did have a query come through early on asking for an update on the rapid rehousing initiative following the early tender advice being removed from Tenders WA. I wonder if what you've spoken about earlier in the timeframe slide may have addressed that query, but if there's anything else you'd like to add.
I think really all that I'll add is that we're very close to releasing it. So we'll give you a concrete timeframe as soon as we can, but it is very close. So Stacey, was there anything you particularly want to add around that?
No, but just to say that we are currently working with our procurement teams to make that happen as quickly as possible.
Okay, so this is quite a lengthy one. Justine has posted a comment saying she's assuming that the process to determine what constitutes an evidence base for viable and sustainable funding will be co-designed. She's acknowledged that they're being asked for funding and costing information already, with a risk that it being taken out of context or only being partially complete, or that it assumes that FDV programs operate as a standalone program rather than as a broader part of an organisation. Is there anything you'd like to add?
Only that it's an excellent point, Justine, and we understand that there's parallel processes occurring at the moment between individual services and their contract managers around really articulating what the issues are for them, what the gap in funding is between the funding that they've been given and the funding that it actually takes to run the service. We certainly are trying to hold it all together, and we'll hold it all together. I've forgotten. Can you read the question again? Sorry, Sandy, I've lost my train of thought.
So will the concern that the viable and sustainable funding will be co-designed, and that there was a concern that the current information requests will mean that the information provided is out of context, only partially complete, or assumes FDV programs operate in standalone environments?
Yes. Okay, so the other point, so certainly we made a commitment that we would undertake this piece of work with organisations and the sector, and we absolutely will do that. So when we get to the sector engagement in September, really the focus will be about testing and refining the thinking in this space, and it will be an iterative process, but we didn't want to come to you with nothing. We wanted to come to you with a starting point. That starting point is kind of global financial analysis, or which includes examination of financials for every individual service, to start to think about what we understand to be the costs of service delivery, as well as context about the operation of services and context about what that gap is. The third point that you made, Justine, I think is a really relevant one, and we were only discussing it this morning, which is that how do we pull apart refuges in organisations where they're delivering multiple different types of family violence services, because we understand that they're not run or operated in silos. I don't have a clear answer on that yet, but it's certainly something that's kind of in our field of view, and that we'll be talking about with the expert reference group and with the wider sector as we build this case for government.
So the next query is asking whether the Social Community Home Care and Disability Services Industry Award and CPI increases will be taken into consideration?
The answer is yes, but I think I'll get you a better answer on that from our finance colleagues to talk about how it will be taken into consideration, if that's okay.
There's a few more queries have come through. We haven't had a chance for many people to like those, so I'll just go through them as I can see them. A request to publish who's on the reference group, please.
Yes, absolutely. So actually and I'll just, the terms of reference for the reference group, we are hoping to finalise with our ERG soon. So I expect that will go on our website and it speaks to the scope of work in a lot more detail, but also the membership and who's on it. So that will be available to you very soon. But in the meantime, I'm happy to circulate the membership list as well.
Okay. Justine replied to your answer earlier saying that thank you, Nicole. The individual support we are getting is fabulous from our contract manager. It's more about the systemic approach. So thank you, Justine.
Thanks, Justine.
Is there a time frame yet for refreshing the CRARMF?
Common risk assessment. Yes, there is a time frame, but we've probably because we are doing this commissioning work, we wanted to take the opportunity to think about common risk assessment in context of that. So if we are designing what we would ideally like our service response to family and domestic violence be, we see the common risk assessment as being sort of a fundamental piece of the puzzle in that space. It's about, to me at least, common risk assessment is about how we facilitate that agency collaboration, how we support and provide pathways for victim survivors through the service system, how we hold the perpetrator and the victim in the same space to deliver safer outcomes. So when we come to you on the 18th, I'll step out a bit of a time frame for how we think that these various activities will occur. Since our last update on the common risk assessment, because we are on our second edition, although the second was released some time back, a lot has changed. So we've got national principles around risk assessment. We can see all the reform work that's happened in Victoria to look at and establish MARAM. There's a lot of learning that we're looking to pick up from our counterparts in other jurisdictions, but also just in the discussions that we've been having with services. We know that there's a lot of really innovative work that's happening here around how people use and apply common risk assessment. And only this morning, I saw for the first time the resource that Health had produced, which translated the screening questions into 20 languages. I had known of that piece of work, but I hadn't seen it. And I just think there's a real opportunity to bring some of that together so that we can actually start sharing some of that really excellent work that's already occurring, as well as sort of do that thinking around what the next iteration of common risk assessment does for us, what we would like it to do, and then how it aligns with that commissioning piece of work.
We have a lovely comment here to say it's great to see acknowledgement of the wider system within which the Department of Communities funded services are a part. And further to that, a second comment, great update, Nicole and Stacey, thank you. Now we're at the next meeting, can you provide an update on the FDVRT redesign work and opportunities for the sector to have input into this?
Yes, absolutely. If you don't mind, we'll do that at the next meeting, but we will make sure that we are well prepared and give you like a good kind of brief on it. So, but I think from what I understand, we'll be in a very good place to talk about it on the 18th of August. And I'll make the point that we come to that meeting with a clear plan for how we will be engaging the sector in those discussions.
With the stage 1 process, are you targeting the mid-year budget review in December for a funding uplift?
So we're targeting the 23-24 budget process, which is December. So mid-year process is August, late August, in terms of our deadlines. And there are quite tight parameters on what you're allowed to take to government at mid-year review. Our sort of advice is that we will have the best opportunity at end of year budget process, which is from our deadlines point of view, December, leading into government consideration early in 23.
And a comment here, given the work undertaken post the Royal Commission in Victoria, great to hear that Marram is a reference for the review. And then the last question I have available at this time, so please, if you have held back to this point, pop it in the chat. Is it possible for the early tender advice on rapid rehousing to be shared with this group for those who missed it?
Yeah, I think we can share the link. So we'll go away and work something out.
Yep. Check. For the safe houses in remote and rural areas, will the difficulty of recruiting safe houses managers be a focus?
I think it's a really good question. It's part of the whole picture. And I think at the moment, we've not really put any boundaries on what we will consider for inclusion in the business case. I think some of those issues are about articulating challenge and cost of service delivery. And then some of those issues are about some of the fundamental things that we'll need to put into the commissioning plan, which is about workforce and workforce development and workforce availability. So we'll probably hold that workforce issue in two spaces, both the business case and the strategic commissioning plan.
And that's all I have for you.
Great. Thank you everyone for your time this morning. And again, apologies about last week and having to postpone the discussion last week. And I guess just another reminder that if you've got an interest, we've got the webinar for the Broome Hub next week. And I believe my colleagues are sending around information and link about that. And then our next webinar will be on the 18th of August and we'll address common risk assessment, commissioning and the family and domestic violence response teams at that meeting. Thanks everyone.